Yes, I welcome you to this interview, sir.
Yes,
You're welcome.
thank you.
And our viewers out there, I welcome you all. This is a very, very interesting session that we have. We have a very brilliant visitor right here. So, sir,
Yes.
would you please give a brief introduction about yourself? People would like to know who you are. Yes, thank you.
Thank you so much. My name is Kisembo Henry. I'm a clinic officer by profession, I'm a medical clinic officer, and I happen to be the executive director, JAYE Uganda, which is Joint Action for Youth Empowerment Uganda. Of course, I come from Kamange district. Thank you.
Oh, yes, thank you very much. I've heard about JAYE Uganda, Joint Action for Youth Empowerment Uganda. Ugandans, I'm really quite sure they could be anxious and they really want to know about this. So, where do we find it? Where do we find JAYE Uganda?
Oh, thanks so much. JAYE Uganda, which I've already told you, it is a joint action for youth empowerment Uganda. And I know people outside there will find it on the internet. When you search it, you find it. It is an NGO, or it is a non-government organization, which basically started last year. And Joint Action for Youth Empowerment Uganda is by the team of the youth,
Mm,
and I happen to be the executive director
mm,
that's of the board, and we do a number of things.
okay,
But apparently, we are located in Kaunge Town Council, which is in Kamunge district in mid-western Uganda.
okay.
That's where currently the offices are. Although we hope to extend our services and offices in the in all regions of the country. That's the northern, the central, then the eastern.
Yes, thank you very much, Dr. Henry Kisembo. Why did you choose to start this? What is the main reason, the main purpose why you really came out and you're like Ugandans and the whole world need something like this?
Oh, thank you so much. Of course, Joint Action for Youth Empowerment Uganda has had a number of objectives where we stand on. As the initiator or the executive director of Joint Action for Youth Empowerment Uganda, we looked at a number of things for us to start Joint Action for Youth Empowerment. Basically, as the team of youth, we looked at the youth. There's the way how they are left out, and leave alone them being left out, we have observed a number of things that are going on, which we ourselves would put right. For instance, if you look at the talents of the youth in the country, they really need to be developed. Because we've got the youth in the country with different talents, and of which they need to be they need to be developed. There are a number of things. Don't look at health sector. In the health sector, the youth deserve to have a good health, and of course, we are to advocate. And of course, our role majorly will be in the community, based in the community, working with the communities, working with other NGOs, international organizations with similar objectives.
Okay.
Yes.
Yes, doctor. You've talked about teenage pregnancies and early marriages. What are those strategies that you really have for Ugandans? Because we very well know that since the previous lockdown, this has been a very famous, quite famous issue about the country. So, what are those plans that you have for the Ugandans?
Actually, the issue of teenage pregnancy and early marriages, as you've talked about it, it is, of course, it's the rampant increase in the country. That was one of the post-COVID effects. During COVID-19 pandemic, of course, when we still had that lockdown,
Mm,
the schools were closed, and of
yes.
course, students were not accessing schools; they were at home in the villages. So that redundance, of course, brought in that element of them not having what. Of course, now if they're not at school, they are not. Of course, they are not entertained, if I may say. But then we are looking at now, if the prevalence of teenage pregnancy and early marriages increase, do we have to keep there and sit, then wait for the outcomes? No. as JAYE Uganda, Joint Action for Youth Empowerment, we are looking at measures on how we can curb the situation. First of all, we are looking into different categories. First of all, we have people, I mean, the youth, that's especially the female gender, who are already culprits of that very problem, teenage pregnancy. They're already culprits, and of course, we can't say we are going to start with those who are not yet culprits. No, even them, they deserve of course, better plans. We have to plan for them. And of course, by maintaining or ensuring they are also represented as Ugandans and as youth. However, they have those challenges, but you can help them both, of course, by giving psychosocial support, because most of them, when they have those teenage pregnancies, they tend to have what we call stigma. They become stigmatized. But it's our role to help our fellow youth who have got such issues to have better life, even though such issues have risen. But then we also have to look at preventive measures.
Yes,
Yes, of
yes.
course, it doesn't mean since the COVID-19 cases have reduced and maybe we are not under total lockdown, it doesn't mean the problem has stopped, because even before COVID-19 we had such. And of course, you understand, we have to look at measures to dig out ways how can we stop that. So, as the executive director of JAYE Uganda, I have got a team of trained technical staffs, of which especially the Department of Health, we have the People Health, and we, of course, work hand in hand with other NGOs, the DHOs, and of course, all the structures in the
Yes,
districts and the
yes.
country. Like, for instance, as JAYE Uganda right now, we are going to base in Kamonge district.
Yes.
And I want to be so appreciative in a way that there are other international organizations which are doing the same.
Yes. Wow,
And
that's good.
of course, we have other NGOs like World Vision. I want
Mm.
to thank them so much for doing that very work, especially in the Department of Child Protection. They have really done it, and I wish if we join hands, we can really, really uplift that very cause and we end it. And of course, we are going to arrange youth camps, like in this holiday when this time is over. We are going to arrange for a youth camp. We are going to welcome all the youth of that category. We are going to have very many services, including the health education.
Mm.
We're going to
Mm.
involve other stakeholders, like those NGOs. They also come
Yes.
in and give talks to the people of the target groups. Because first of all, stopping teenage pregnancy or early marriages doesn't mean only arresting the people who are the culprits, eh? Those who have done it, of course, the male gender. But then, as youth, we found out we can reach out there in the community. We talk to our fellow youth, we advise them on how to prevent such.
Oh, yes, doctor.
Yes, yes.
So, what do you request? Oh, that's really good. That's really powerful. What do you request the community as a whole?
Basically, the community, of course, we request for their cooperation. Of course, we are going to the community outside there, like we are going to Kamonge district. We are going to visit all communities. We are going to have youth
So,
camps.
the community should get involved in the activities.
Yes, of
They should
course.
welcome the
Ha,
services.
ha,
Wow,
very
that's
good.
powerful. So, are there any other programs that you have for the country? Tell us so that Ugandans
Uh,
and the entire world can be anxious to receive this.
Joint Action for Youth
Yes.
Empowerment Uganda, we
Mm.
have a number of activities, a number of departments. One, we have the health sector, which we've already talked about. We have child protection department. We also have education department. We have youth livelihood and resilience. Of course, those are the departments we have, and
Oh,
we
that's
also have
powerful.
our
Mm, mm.
objectives under them.
That's really good. So, thank you very much, Dr. Henry Kisembo from Joint Action for Youth Empowerment Uganda. I will be glad to have you next time. Thank you so much.
Thanks so much for your time. Thanks so much.